welcome to The Point. It is Wednesday, May 11th, 2022. Thank you to those of you joining us on the GBN Grenada Broadcasting Network's Facebook page, the GBN Production YouTube channel, the website www.gbn.gd, GBN TV channels 7, 11, and 20, and good morning to the loyal listeners of Classic 105.5, 105.9. Welcome to the program, and want to say welcome to our virtual guest this morning, Chief Medical Officer in the Ministry of Health, Dr. Shawn Charles. Thank you very much for joining us, sir. Appreciate your appearance as always. Thank you.
Well, a warm good morning to you and all your viewing and listening audience. And of course, it's a pleasure being here once again. And thank you for having me.
Appreciate it. We're going to get right into it, and we're going to start with COVID-19, which has been dominating health news for the past 2 years. And with the past few weeks, it has once again reared its head in Grenada. The latest dashboard as of yesterday showed just over 1,100 active cases. While this is still startling, it's not unexpected, correct?
Yeah, this is correct. It's not unexpected at all.
How did we, or I should ask, why is it unexpected for the people who, maybe not aware?
All right. Well, let me first say that the pandemic never ended. And since Grenada developed community spread sometime back in 2020 or 2021, it slips me now because there's so many dates that have passed. Since we developed community spread, the disease has never left our shores. So we have always had cases of COVID. There are times when we experience huge increases in cases, and following which the number of cases have decreased. We, up until recently, had a low period where the number of new cases that we were recording were very, 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 very low, minimal, but never zero. All right, never zero. We always had a few cases here and there about. As we know, the pandemic is caused by a virus that changes very frequently, and it changes in an effort to survive. And as a result, it becomes easier to spread, more transmissible. And as a result, it causes successive waves or, successive outbreaks. And it's the same thing that is happening here, the same thing that is happening elsewhere in the world. Right now, we are experiencing another period where we are seeing an elevated number of cases. And I mean, there are many, many factors that contribute to this. But principal among them is the fact that many persons are they're not taking any measures to protect themselves and to protect their families from getting infected, right? And that is the principal driver of this pandemic. If persons are not taking actions to protect themselves, then the virus will find individuals and it will continue to cause infection. And that is basically all it boils down to.
It also comes at a time when we officially lifted the state of emergency, which was made official in Parliament yesterday. Has any consideration been given to reinstated one or two of these measures? Even though we have to live with COVID and learn to live with COVID, any consideration?
I will answer this way. I don't think that any country or any state would like to live under a state of emergency for any extended period of time, because these are extraordinary measures or extraordinary lengths that governments may resort to maybe protect the public, all right? And I do not think that they are meant to go on and on forever because they disrupt normal life. So we could not keep a state of emergency forever. And it's not something that, from a public health point of view, we will recommend either, because health is not only about COVID. We have to think about the effects of a state of emergency and all of the disruptions and all of this discomfort that it causes, and how it affects people's mental health, how it affects people's ability to earn and feed their family and feel fulfilled, because health is not simply the absence of disease, all right? So it was inevitable that the state of emergency needed to be lifted. But in addition, I think what many persons may have been confused about is that what was done is that the legal requirement to take certain protective measures was removed. So before, you could have been fined for not wearing a mask. That was removed. All right? Before, there were restrictions on hosting of activities, which limited persons, common freedoms. Those were removed. However, what persons needed to understand is that now that the legal requirement to take measures to protect yourself was removed, does not mean that the pandemic ended. It means that now the responsibility now lies in your hand to take whatever measure you deem fit to protect your health and your life. The pandemic never ended. All right? It's just that we could not continue with the restrictions, all right, and the legal mandates. But the preventive measures must still continue to be exercised in order to prevent the spread of disease.
We have also not been hearing much about new variants. The speed with which variants were coming out with, let's say, last year, that has seemed to slow down. Or is it that we're just not hearing much about them?
I think we're just not hearing much about them, because the thing is, new variants pop up all the time. The issue is only a few of them they cause significant change in, for example, their ability to infect persons and their ability to cause severe disease. And those are the ones that you really hear about, because variants pop up all the time. Many of them are of little consequence. They're not worse than the variant that is currently circulating. All right, they're not causing more severe disease. They're not infecting persons more. In fact, many of the variants that pop up, the mutations that they contain ensures that they are themselves not able to survive for a very long time. So they come and they go. But the ones that are of significance, they cause increase in the number of infections and more severe disease. These are the ones that you hear about, and then the WHO would name them a variant of concern or a variant of interest, based on how they affect the population.
Vaccination as well against COVID-19, I would imagine that has slowed down significantly.
Oh yes, that has slowed down significant. I guess significant might be an understatement. Many persons do not, maybe they do not think that vaccines are important. An important element to combat the pandemic. Of course, we know all about the misinformation around vaccines. We know all of that because we've gone down that road already. But for whatever reasons, the number of persons that are coming forward for vaccination right now is minimal. And we're doing, and this is occurring at a time when we have maybe all of the major options of WHO authorized vaccines here in Grenada available to the population. All right, so the vaccines are there and are available. And of course, we know that they have been proven safe and effective. And all we can do is continue to encourage persons to do the right thing.
Speaking of vaccination, yesterday in Parliament, Minister Clara Smithers-Corwin, Minister of Tourism, she made a statement in relation to some information that she got from the Ministry of Health in relation to a reduction in general children's vaccinations. And this time it's not just COVID, we're talking about the other vaccines that we were made to get as children. How significant is that decrease?
It's notable. It's notable. Now, the thing is, this is not an issue that only started with COVID. This has been occurring for some time. We have noticed that over the years, we are seeing increased reluctance of persons to have their children receive the routine childhood vaccinations. The challenge with COVID is that with all of the misinformation that was generated around COVID vaccines, routine childhood vaccines also became a collateral. All right, so persons were confusing all of the issues, and it resulted in less inclination to bring your children to get vaccinated. Now, there are many factors, all right, because we know that during the COVID period, earlier we had lockdowns that limited access, and later, as we had subsequent waves, even our health staff was stretched. And when I say stretched, meaning that they were stretched between the demands caused by the surge of persons needing attention as a result of COVID, while at the same time trying to maintain the routine health services that are available in the population. So these may have contributed to a decline, and of course compounded by increased hesitance towards all kind of vaccines, because when misinformation started flying about vaccines, many persons who, didn't understand the information too well, they sort of, linked all vaccines or put all vaccines in the same basket. So all of these factors resulted in reduced uptake of routine childhood vaccination, which is a dangerous thing. It's a dangerous thing, and it's a road that we really do not want to go down, because we do understand how terrible that could be.
What efforts, or will we be making efforts to encourage parents to keep up with getting their children vaccinated, or are we just hoping for the best?
Well, we have taken many, many steps to address this situation. We've had mop-up activities or mop-up campaigns, meaning that in the districts and in the communities where problems were identified, we've had our nursing staff going out, being transported to different communities to search for these children to get them vaccinated. There has been an increased push at educating these parents at the level of our community facilities to get vaccines. And I can tell you, there's an all-out push to at least get us back to a safe space. Recently, we had Vaccine Week in the Americas, and there were a lot of outreach activities as well in different communities. I know the community in the South, they went through all the communities and then they ended in Camahan Park. And this was done in many of the communities around the island. Also, we have our health team visiting the schools to identify students that were not vaccinated. But even that is a challenge, because I'm sure back in the day, you remember when the health team came to the school, children were simply lined up and we got our shots. And there was no issue. Now it's completely different. All right, now it is completely different. Very difficult to achieve this at schools now because parents are outright against you touching their child at schools. So we have a lot of ground to cover, but we continue to work to ensure that we get our numbers back up and we protect our children.
And speaking of children, I recently heard, yesterday actually, of an outbreak of chicken pox in at least one school or maybe one child. Have you had that report?
All right, so I have heard this rumored as well. We have not received any reports. In fact, we reached out to our clinics, and we have not had that report come into the Ministry of Health yet. But yes, that rumor was being circulated. Now, I will just say this: there are diseases such as chickenpox, such as hand, foot, and mouth, that almost on a yearly basis we do get a number of individuals who come down with this disease. Now, especially in the school environment where there are many young children in close proximity, I mean, these are settings where diseases spread easily. And this is one of the reasons why we encourage persons to get their children vaccinated. All right? So it is possible for there to be an outbreak of chickenpox in a school. It's not unusual. Just like it is possible for an outbreak of hand, foot, and mouth, so these things do happen from time to time, right? But we continue to monitor. Once we identify, then of course we take whatever appropriate measures in order to avoid any problems.
All right, Dr. Charles, let's take a break and come back. I know there are people eager with questions. I see a few on the social media already. You're tuned in to The Point. We're speaking with Chief Medical Officer Dr. Shawn Charles. We'll be right back.
COVID-19 is an infectious disease caused by a new coronavirus introduced to humans for the first time. It is spread from person to person, mainly through the droplets produced when an infected person speaks, coughs, or sneezes. These droplets can land in the mouths or noses of people who are nearby. These droplets are too heavy to travel far in the air. They only travel approximately 1 meter and quickly settle on surfaces. This is the reason person-to-person spread is happening mainly between close contacts. The exact time that the virus can survive on surfaces is not yet known. So it is wise to clean surfaces regularly, particularly in the vicinity of people infected with COVID-19. Hands touch many surfaces, which can be contaminated with the virus. You should therefore avoid touching your eyes, nose, or mouth, since contaminated hands can transfer the virus from the surface to yourself. When coughing or sneezing, cover your mouth and nose with the bend of your elbow or use a disposable tissue. If a tissue is used, discard it immediately into a closed bin. The most effective way to prevent the spread of the new coronavirus is to clean your hands frequently with an alcohol-based hand rub or soap and water. This will eliminate the virus if it is on your hands. Stay healthy and prevent the spread of COVID-19.
Are you a small business and would like your business to grow? Do you have an event, products, or services that people should know about? Be wise. Advertise. Book your spot on GBN Shopping Guide. Be part of Grenada's biggest advertising medium, the Grenada Broadcasting Network. Call our sales department now on 440-2446 or 440-3033 or GBN plus the number sign. Email us at sales@gbn.gd. Special conditions apply.
It's mentioned the wing high, then you have things like man, you must come back, you know. We have the low power there.
It is kind of like the same man, and it's just different name for the same kind of thing.
And last but not least, I just want to say to all the men who saw me, call me, and ask for a piece of cake. I'm baking this weekend.
Join us Fridays at 8 on GBN Television, K105 FM, GBN's Facebook page and YouTube channel for We Culture.
Welcome back to The Point. We're speaking with Chief Medical Officer Dr. Shawn Charles. Let us now open the platforms for our viewers and listeners who may have comments, questions, queries, concerns for Dr. Charles. Let us start with, let me remind you, the landline number, 435-2041. The WhatsApp number is also 435-2041. Please, no calls on the WhatsApp, only written messages, maybe a voice note or two. But let's open the phone lines. We have our first caller of the program. Good morning, caller. Good morning, caller.
Good morning.
Morning.
I want to say, I'm not saying it, but I will say it. Now, I understand through the media that we got a lot of vaccine and different types of vaccine. Now, after listening to that, I could remember a few months when we got our vaccine, people said, or the medical professionals said that vaccine could only last for a certain time. The particular vaccine we got. Now we have so many. In fact, I could remember we also gave Trinidad some because they couldn't have stayed, they would outlive their shelf life. Now we have so much. And yet for all, people are taking less vaccine. Now, I want to know that if those we are getting now, even with the same quality, we're getting a bigger quantity now, if they have a longer shelf life, and if people we think would be taking more because we have different types of vaccine. So I want you to maybe make a plea on the population to say, well, they're taking it more on the government side or on your side. Explain why we have so much and yet people are taking less. To me, thank you very much.
Thank you very much, caller. Dr. Charles?
Let me say that we have, for example, at present, we have Pfizer vaccines, we have Johnson & Johnson, we have Moderna, we have Sinopharm. So we have the largest range of vaccines, at any time. At any time. So the population can exercise whichever choice that they want. Now, each vaccine comes with its, just like any other product, it comes with its shelf life. Once that shelf life is reached, once that expiry date is reached, then it has to be discarded. All right? So the vaccines that we have, if the population is unwilling to accept, then we will have a large volume of vaccines that we would need to discard. All right? We certainly encourage persons to come forward, get vaccinated to protect yourself. All right? I know that there's been a lot of drama and misinformation, and remember, all of this is a personal choice. All right? It is a personal choice. We encourage everyone to come forward and get vaccinated. All right? Do so to protect yourself. If persons do not come forward and get vaccinated, then we have no choice. The vaccines that were unused, we simply would have to discard. And that is just a reality of life. Not sure if there is any other way I can answer that question.
And speaking of vaccines that we've received, I know we got at least one shipment of Johnson & Johnson vaccine. I think it was sometime last year, August or so. And just last week, I saw a notice from officials abroad advising to limit the use of J&J vaccine because of the threat of blood clots. Have we started to maybe pull back on administering the one-shot J&J vaccine?
Well, I mean, every vaccine has there is a age range, or there are individuals that, you know, you would preferably administer one or the other. Okay? And of course, as more information is produced with regards to vaccines, we will make adjustments to the persons that the vaccines are recommended for. All right? So persons who may have a tendency or at risk for a particular health issue, then we may say no. We recommend that no, you preferably use this one maybe as opposed to the other. All right? What persons need to understand is right now there is choice. All right? There is choice. And we'd like persons to exercise their choice and choose whichever they prefer to protect themselves.
A question on Facebook. Somebody on Facebook asks, I agree we can't continue under a state of emergency because it would also impact on the tourism sector. However, why did we remove testing from our various ports of entries? People traveling to the U.S. must have a negative PCR test on entry. So why did we remove that part? Why did we not keep that part of our protocols?
All right. So there was a period, actually a long period, when we had testing, all right, and we had testing, and that testing was PCR only, all right. There was a period when we had PCR only testing for coming into Grenada, yet we had an outbreak, all right. There was a period when we had PCR and antigen, yet we had an outbreak. What I want persons to understand is, and I think I've said it before, Grenada has community spread of COVID. And the persons need to understand what that means. All right? When your country has community spread of a disease, it means that the disease is spreading from person to person in your community. Whether your borders are open or not, whether you have testing for persons going into or out of a country or not, the disease will continue to spread in your country until each individual in the country take steps to protect his or herself. So please do not be distracted by these elements. Okay, whether there is a test for someone to travel or not has little bearing on whether you will get COVID or not. What will prevent you from getting COVID is if you are taking measures to prevent yourself from getting infected. That is the only way. That is the only way. Our healthcare providers are caring for COVID patients every single day on our wards and in our clinics. And in the majority of cases, they are not falling infected. Why? Because they are taking measures to protect themselves. And that is all we are encouraging the public to do. Each must take whatever measure he believes is necessary to protect himself.
There's a question on the WhatsApp. Somebody on WhatsApp says, Dr. Charles, are you aware that Grenada has by far the highest number of active cases in the OECS, approximately 4 times that of St. Lucia? Does that not bother you?
Of course it bothers me. All right? Of course it bothers me. Now the question is, am I the only one that is bothered about this? And are we prepared to take the steps that we know that we must take in order to prevent this from occurring? Because I can tell you, whether I'm bothered or not, I cannot go to every individual's home and fit a mask on them and ensure that they wear it. Right? Remember, public health largely requires me to give you enough information so that you can make a decision to protect yourself. But I cannot do that for you. I cannot wear the mask for you. I cannot, and the Ministry of Health cannot do that as well. I cannot prevent you from attending risky scenarios, risky events. I think what is more concerning is that knowing that Grenada has, increasing number of COVID cases, we are not seeing a let up in the number of social activities, the number of fetes, the number of rallies, we are not seeing, any encouraging signs that someone out there is saying, okay, maybe I should hold back this event. All right, or maybe I should not attend this activity. In fact, what we are seeing is the opposite. We are seeing increased number of activities, and we are seeing increased number of gatherings. All right. So, we are, I wouldn't say we are at an impasse. All right. But we are at a place where we need to really inspect, look at ourselves, inspect ourselves and see, what we might be doing that might be influencing what we are seeing.
All right, let's go back to the landline. Good morning, caller.
Good morning, Citizen Welsh, and good morning to the doctor. Tell me, can the doctor hear me well?
Can you hear him, Dr. Charles?
Can the doctor hear me well, Citizen Welsh?
I was using the wrong thing. Can you hear him, Dr. Charles?
Yes, I can hear him.
Very well. Listen, doctor, greetings, good morning. Couple of observations I'd like to make. One, can you give the country any information on the use of the medication metformin, used for blood sugar control? Earlier in this year, there was a recall of this product. It was never spoken about here in Grenada. That's one. The other thing is this, doctor. I've noticed in recent times that we have a serious deficiency in the supply of medication generally to the population, of course, including those who have gone over the 70. Because of shortage of staff, pharmacists particularly, and lack of medication for instance, in my case, Monday I had to buy all but one of the 4 medications that I normally get. What is really happening, doctor? Can you spot some light on it? And finally, COVID struck us. So many uncertainties there were because the world knew almost nothing about it. So states of emergency had to be put in place, a lot of action taken back because people were confused. But we have reached a stage that we have seen it, this morphology, all its, they call them again, the changes and variants and whatnot and whatnot. We have had 211 deaths, or 21 so far I've heard recently. But doctor, has your entity studied in depth and can produce statistics to compare deaths by COVID as a result of or affected by COVID versus deaths by air pollution in this country or from the effects of air pollution? I'd like to get some statistics. I heard Dr. Ford in a radio program recently. Give us some amazing facts. I heard recently from the World Health Organization that every minute in this world, 13 people die as a result of the effect of air pollution. And air pollution in this country is a major problem.
Thank you.
Can you give us some statistics on that comparatively? And of course, my other questions and concerns. Thank you very much and have a nice day, will you?
Thank you very much, Susan Roloff. Go ahead, Dr. Charles.
All right. So, yes, with regards to the metformin now, occasionally medications are recalled for various reasons. Now, a recall generally is specific to a manufacturer or maybe limited to a batch of medication. So there are times when a recall will be issued for some medications for whatever reason, and then that would be removed. The medication produced by that manufacturer would be removed from the market. But once that occurs, then it would need to be sourced elsewhere. Delays can be created in finding another source because many of these medications, especially medications like metformin, these chronic disease medications, we source them through the OECS procurement system. So, there will be a delay in finding a new manufacturer, and of course, about the supply chain issues that have occurred recently, and all of that is influencing the availability of some of these drugs. But once that is resolved, metformin is one of the medication that we almost always ensure that we have in our system. So with regard to the supplies of medication, like I mentioned before, there are different factors that can affect that. Like I say, supply chain issues, and yes, we do have human resource challenges as well. Having sufficient pharmacists is one of them. Sufficient nurses, sufficient doctors. These HR challenges continue, and those we cannot ignore. And yes, they can cause delays in the service. All right, these are not things that we like to see, but yes, they do occur. Now, with regards to the deaths, now we are still gathering information on all of the deaths that occurred during this pandemic. All right. What is certain is that there have been an excess number of deaths in Grenada. Some have been as a result of COVID, and some have been related, but not as a result of COVID. All right, service disruptions, different things that contributed to death. Once we have all of the information, we intend to prepare a report which will be released so that everyone can see. Now, with regards to deaths from air pollution, I can't say that this is one area that we have been actively collecting data on, because while air pollution is a global challenge, its measurement here in Grenada, all right, has not been, I'm not aware of any agency right now that is actively monitoring air pollution at present. And there are sometimes some local factors that influence the quality of air, because in general, the air that we breathe in Grenada is relatively better than in many regions. And there are a lot of local factors that sometimes influence the quality of the air that persons are exposed to in their communities. So if you are close to a factory, or if you're close to maybe a farm, if you are in communities where persons habitually do burning of organic matter, could be plants or so. If you are close to a roadway that is very dusty, all of these affect the air quality in your localized area. Yes, this is an area for study. And at present, I do not have data on them.
All right, I think that covered the questions. Let me go to Facebook. Somebody on Facebook says parents visiting community health centers for routine vaccine shots for children are told there's no IPV, subject to correction on the name. It's the one given to 18-month-olds. So there are some health centers who do not have, if it's IPV vaccines. Have you had that report and any corrective measures being taken? Not corrective, but to replenish the stock.
All right. So we order vaccines annually. All right. And like I say, vaccines have been one of those that have suffered from supply chain issues. However, if you have visited your clinic and they do not have the particular vaccine that your child needs at the time, please don't forget to follow up. All right, because we may not have it at one particular time, but once our stocks arrive, it will be made available and free of cost for the public. So what we ask you to do that, yes, there can be supply chain issues at times. If you are unable to obtain a particular product at a particular time, please follow up, because we want to ensure that the child is vaccinated.
WhatsApp, somebody is asking for a reminder on how long the virus remains on various surfaces, example, plastic, metal, groceries, etc.
All right, well, that varies. All right, that can vary based on environmental conditions, anyway from minutes to many hours. All right. What I would encourage that person to do is to ensure that your hands are sanitized, because whether the virus is on a surface or not is of little importance if you do not sanitize your hands, all right? Because it's contaminating your hands and touching your face, touching your mouth, your eyes, and your nose. That is where the challenge lies. So we encourage everyone to wash and sanitize hands often to prevent themselves from coming in contact with contaminated surfaces and infecting themselves.
Let me stay on WhatsApp for this one before we go to another break. Somebody says, Dr. Charles, I have a friend who is fully vaccinated. He got COVID twice. His wife is frustrated. She still has to look after him, and she is a senior citizen. My question is, why after taking the vaccine, his life is still in jeopardy? His wife did not take the vaccine and never had COVID.
All right. So even if you're vaccinated, and this has been proven now, all right, this is not a debate anymore. Even if you have been vaccinated, you can still get infected. All right. However, the vaccine protects from severe disease. All right. It limits you getting severely ill. All right. Needing hospitalization and possibly dying. To prevent infection, you have to limit exposure to the virus, all right? And this is something persons must understand. To prevent infection, you have to limit exposure to the virus. Now, if the individual that we are referring to here is a person that is homebound, all right? The person has limited mobility. It means that someone is carrying the individuals repeatedly, all right? And it is resulting in him getting infected. Right? And this is where I think the greatest challenge is. In order to prevent this individual from becoming repeatedly infected, we have to prevent persons from repeatedly exposing him to the virus. That is the only way you're going to stop that cycle. All right, and persons must understand that even if you're vaccinated, you can become infected. All right, this has been proven. The vaccine will go a long way in protecting you and preventing you from falling gravely ill.
Speaking of vaccines, somebody on WhatsApp as well asked, if someone has been fully vaccinated with the 2 doses and 6 months have expired, can that person now take the booster shot, or does he or she have to start all over? Put in another way, is someone considered fully vaccinated after 6 months have expired since the second dose?
All right, so that is a very good question. I think yesterday we published a document that I think addresses all of that. Persons after receiving their 2 shots, we recommend that you get a booster at least 5 months after. All right, so 5 months after, except for Johnson & Johnson, where we recommend that you get a booster 2 months after. All right, so that individual can go on and get their booster shot. I mean, it has been, and this has been demonstrated, that yes, immunity to COVID wanes with time and with successive variants of the disease. It's just a reality.
All right, let's take another quick break, and then we're going to come back and wrap up the discussion with Dr. Charles here on To The Point. You're tuned into Classic 105 and GBN. We'll be right back.
COVID-19 is an infectious disease caused by a new coronavirus introduced to humans for the first time. It is spread from person to person, mainly through the droplets produced when an infected person speaks, coughs, or sneezes. These droplets can land in the mouths or noses of people who are nearby. These droplets are too heavy to travel far in the air. They only travel approximately 1 meter and quickly settle on surfaces. This is the reason person-to-person spread is happening mainly between close contacts. The exact time that the virus can survive on surfaces is not yet known. So it is wise to clean surfaces regularly, particularly in the vicinity of people infected with COVID-19. Hands touch many surfaces, which can be contaminated with the virus. You should therefore avoid touching your eyes, nose, or mouth, since contaminated hands can transfer the virus from the surface to yourself. When coughing or sneezing, cover your mouth and nose with the bend of your elbow or use a disposable tissue. If a tissue is used, discard it immediately into a closed bin. The most effective way to prevent the spread of the new coronavirus is to clean your hands frequently with an alcohol-based hand rub or soap and water. This will eliminate the virus if it is on your hands. Stay healthy and prevent the spread of COVID-19.
Are you a small business and would like your business to grow? Do you have an event, products, or services that people should know about? Be wise. Advertise. Book your spot on GBN Shopping Guide. Be part of Grenada's biggest advertising medium, the Grenada Broadcasting Network. Call our sales department now on 440-2446 or 440-3033 or GBN plus the number sign. Email us at sales@gbn.gd. Special conditions apply.
Mr. Mentioned the wing kai, then you have things like manual boss combat, We have the low power that.
It is kind of like the same man, and it's just different name for the same kind of thing.
And last but not least, I just want to say to all the men who saw me, call me, and ask for a piece of cake, I'm baking this weekend.
Join us Fridays at 8 on GBN Television, K105 FM, GBN's Facebook page and YouTube channel for We Culture.
Welcome back to The Point. Wrapping up the program this morning with Chief Medical Officer Dr. Shawn Charles. There was a question on the on Facebook. hold. Let me make sure I have it right. Somebody on Facebook asks or says, Dr. Charles, during the last carnival season, although we didn't have carnival, we saw pockets of jabs in different parishes, and then there was an outbreak of COVID in which you and Minister Steele blamed the jab. Now you and the minister are given the green light for carnival, including the same jab. Who were blamed? Question: we see the rise in COVID once again soon after we removed the protocols that were keeping us safe. Can you tell us that do you think it is the right decision or time to remove all the protocols while we're seeing a rapid rise going into the carnival season? Yeah.
All right. So, this is a typical question of persons who they may not have understood what transpired. The Ministry of Health has not removed any protocol whatsoever. The legal mandate, which requires you to wear a mask or be charged by the police and pay a fine or go to court. The legal mandate that you must sanitize and you must distance, and businesses must write for permission in order to have an activity. This is what was removed. It means that the police will not charge you if you do not wear a mask. It means that if you're not maintaining distance, all right, they will not shut down your operations. Or if you didn't ask for permissions, the police would show up and shut down your operations. It means that if you're not vaccinated, there is no legal requirement that if you're not vaccinated, you can't go to a restaurant. This is what was removed, and I think I need the assistance from the media here to explain, because it is possible that maybe the messenger is the problem, and maybe persons do not understand this. What was removed is the legal mandate. The Ministry of Health's recommendation that you should wear a mask, that you should distance, that you should sanitize, that you should avoid risky settings. All of these remain. We continue to recommend these. I'm not sure if I have explained it clearly, Blossom. Maybe you can help me here, and the individual might understand.
I'd probably use your same words, just like you said it. I'm not sure it can be put any simpler. But yeah, I've been encouraging people to employ their own personal protocols and restrictions ever since I returned to the morning, and hopefully they understand what's taking place. Dr. Charles, it's time for us to wrap up the program. Any final thoughts that you'd like to share? Somebody on WhatsApp is asking, is the booster compulsory? So maybe you can answer that while you're in your closing comments.
No, nothing is compulsory, all right? We recommend that persons receive the booster, all right? And we certainly encourage them to do so. But no, it is not compulsory. In my final closing thoughts, I would just say that, I was a bit disappointed with all of the activities, and even with this rise in cases, I must say I was a bit disappointed, because I know that right now we have our children preparing to do CPA tomorrow, our young ones. I think CXC exams were delayed by about 3 weeks, but by the end of the month, we have CXC exams. I would have liked to see that all of these events that are occurring, all of these, no matter what the nature, that we would have tamped down on this a little, at least give the children a chance. Not have them do exams in a setting where we have a whole bunch of cases and probably some of them might get sick. I'm too sick to do the exam. I really thought that we would have done the responsible thing and say, okay, as promoters, as festival organizers, as rally organizers, we would have done the responsible thing and say, let us give the children a little chance. And maybe to run up to Carnival, maybe we can, the events can start maybe later in June, July. But that is not occurring. I just encourage everyone, listen, this pandemic is not done and is not going away anytime soon. It is our individual actions that ensures that this disease is rising in Grenada. All right? It is our individual actions that will ensure that we control it. All right? There is no longer a requirement by law for you to do X, Y, or Z to protect yourself and your family. We want you to do it voluntarily. And do not look for the Ministry of Health or the government of Grenada or any other persons to do it for you. And like I said, no one could wear a mask for you. No one could prevent you from going to a party or rally or whatever. No one could prevent you at present from engaging in any kind of risky behavior. All right? All we ask persons is to be responsible. Do the responsible thing. This disease will continue to get more cases as long as people continue to create the setting where the disease can spread. And the only way we can reverse this is if we continue to do what we know we must do. And that is to obey the protocols. And that is all I encourage persons to do. I encourage everyone to do what he deems is right and fit, protect himself, and please, when you see things occurring, don't blame someone else. All right? Don't blame someone else. All right? This is a look in the mirror time. We encourage everyone to follow the protocols, wear a mask when in public, when in the presence of persons that are not in your house. Maintain appropriate distance. Avoid crowded, gatherings, especially when there is close contact with individuals not wearing masks and the ventilation is poor. Avoid these. And no matter the setting, you need to avoid it. Wash and sanitize your hands often. Get vaccinated. Get boosted. All right? Protect yourself. And that is my encouragement to everyone.
Appreciate that very much, Dr. Charles. Thank you so very much. And we shall, of course, hear from you in short order as we continue to traverse the ravages of COVID-19. Thank you very much. Enjoy the rest of your Wednesday.
All right. Thank you.
Thanks. That was Chief Medical Officer in the Ministry of Health, Dr. Shawn Charles, our guest this morning. We thank him very much and thank you, viewers and listeners, for always tuning into the program. Appreciate your listenership, your viewership, and your time. This is the end of my time for today. Enjoy the rest of your wonderful Wednesday. I'll be back tomorrow morning, God willing. But in the meantime, I leave you in the capable hands of the one and only GT. Have yourselves a blessed day, everybody. Bye-bye.